Hey everyone, my name's Ida.
My name's Lean.
Okay, and we're gonna be showing you guys what flexion and extension is. Go ahead.
Flexion.
Flexion, extension. Flexion, extension.
My name is Manuel Cruz, and this is Michel Suarez, and we're going to talk to you about protraction and retraction.
Alright, so protraction and retraction are the anterior-posterior movements that either occur in the scapula or in the mandible. Now, protraction is when the scapula is moved forward, like when you throw a ball, like he's gonna explain now. And then retraction is when the scapula is moved posteriorly and medially, to towards the spinal cord, like that.
And then in the mandible, the protraction and retraction can occur as well. Protraction in the mandible is when the mandible comes forward, and retraction is when the mandible, after coming from protraction, goes backward and goes in the normal position.
The rotation of the head and neck is a common movement of the ball and socket joints, and it is basically a person saying no.
The head is rotated by the neck muscles when they act unilaterally. The major muscle that rotates the head is the sternocleidomastoid.
You know who it is. Alright, so we're doing internal rotation and external rotation. Internal rotation is the rotation towards the center of the body. Alright, external rotation. External rotation is rotation away from the center of the body.
When it comes to inversion and eversion, inversion is moving your feet away from the midline of the body. So the sole of the feet is going to go away from the midline of the body. Eversion. Or that.
When it comes to eversion versus inversion, inversion is the inward motion of an extremity. For example, my right leg, I'm inverting it, so moving it towards the midline.
Dorsiflexion is the action of raising the foot upwards toward the shin. It means the flexion of the foot in the dorsal or upward direction. People use dorsiflexion when they walk. For a movement to be considered dorsiflexion, the foot should be raised upward between 10 and 30 degrees. Dorsiflexion moves the muscle in the front part of the foot.
Plantar flexion is a movement in which the top of your foot points away from your leg. You use plantar flexion whenever you stand on the tip of your toes or you point your toes. Plantar flexion is the opposite of dorsiflexion and involves moving the foot in a downward direction towards the ground. Plantar flexion occurs when the foot is moved downward between 20 and 50 degrees.
Hi, I'm Robert and this is Greg, and we're going to be doing the examples of pronation and supination.
Pronation and supination are a pair of unique movements possible only in the forearm and hands, allowing the human body to flip the palm either face up or face down.
So this will be the example of supination, and this will be the example of pronation.
Hi, I'm Melanie Relis.
And I'm Michel Suarez.
So today we're going to be demonstrating the body movements of elevation and depression. So we're going to start off with elevation, which is when you move a body part in a superior direction, and he's going to demonstrate that right now. So that would be elevation. Now the other one would be depression. Depression is when you move a body part in an inferior direction.
Like that.
Like that. Thank you.
Yeah.